if you would like to access the French a session about psychosocial oncology, you will have to need to go to the concurrent session. I put the link here. So wherever you want to stay, please just join us. Psychosocial oncology, our patient partners in the morning as well. And later, Derek emphasized how important it is while going through the cancer journey. So our next speaker is Marianne ARAB from Nova Scotia. Hi, Marianne. Are you online?
I am.
All right. Hey,
Good. Can
how
you hear
are
me?
you?
Okay, that's the first hurdle passed. Now I'm going to
Yes.
try to
Share your
share my
slides.
screen. If I can find share content.
And in the meantime, I'm going to just say that this session will also be recorded. So just be mindful of the privacy, folks. Okay, all yours, Marianne. Take it away.
Thank you so much. Can you see my screen okay? Can you see the presentation?
I do.
Okay, good. So thank you so much, SEFTAP, and for all of you for inviting me to present today. I thought a lot about the presentation, and I wanted to, there's so much involved in psychosocial oncology, and one of the things I hear most from patients is they didn't know it was available, they didn't know what it was, and I recognize that our language sometimes, especially in healthcare, is doesn't really meet the needs of our patient population, and it's really hard sometimes to find the right words and the right language. So I'm going to do my best to explain what this is, why it's important, how it can help you as a patient, but as a healthcare provider as well, to know and understand resources is one of the most important things I think you can bring to your patient encounter, and making them aware of what is available and what's out there to help them. So I'm going to go through that, and I'm hopeful that I think we should have time to have a little discussion at the end too, because I would be really interested in hearing people's thoughts around this, and if you've accessed psychosocial help, what it looked like for you and if it was helpful for you. So I'm going to get started. So, or maybe I'll just say, so my background is social work. I was a clinical social worker before I moved into this role with the Provincial Cancer Program, and I worked in mostly oncology and palliative care. And so that is my area. That's the area I work with now as well. And my goal really has been to ensure that all cancer patients get the help that they need, regardless of where they're at in their cancer experience. And psychosocial oncology, I'm going to give you kind of the, of course now my screen is not, there we go. I'm going to give you kind of the formal explanation of what it is, but people often ask me what is it that you do? And I've kind of summed it up by saying basically psychosocial oncology and psychosocial health services are the areas of care that address everything outside of the medical treatment aspect of care. So for those of you who've gone through cancer, for those of you who work with cancer patients, you know without a doubt the impact cancer has on all aspects of a patient's life. So regardless of regardless of the type of cancer they're diagnosed with, it changes who they are. And oftentimes people talk about learning to live with the new normal, whatever that might look like for you. But when we try to talk about what that means, we break it down into the social aspect of life, your psychological aspect, emotional, spiritual, practical. That's a big part of it. People don't realize the financial impact of cancer. People think we live in a country where we have free healthcare, which we do, but there are so many pieces, as you've probably all experienced, that are not part of that free healthcare. And many people are not prepared for that when they get a cancer diagnosis. So basically, we look at who the patient is and all of the pieces of who they are. It's a whole person approach. And it focuses not just, even though here I have focuses on the emotional distress, but the emotional distress that comes from all of those other pieces of your life that are impacted by cancer. And I just want to give a brief. So psychosocial health services are kind of the umbrella term that we use across Canada to describe psychosocial oncology, but also we talk about, and I'll go to another slide, we talk about supportive care. So both of those things kind of fall under psychosocial health services. So who are the people who provide this care? So most of them are people who have who are specialized in counseling or psychotherapy, and they're able to provide a higher level of, they're able to work with patients with more complex needs than perhaps frontline staff like nurses and radiation therapists. So they include psychologists, social workers, spiritual care specialists, psychiatrists, mental health advanced practice nurses, but there's many in the field of nursing too who have a specialty in working in psychosocial oncology. And then supportive care, and I talk about these two pieces because I think it's important for you to know that everybody that you come into contact with within your cancer care team should be able to provide you with basic emotional support and at minimum supportive care services. And so that includes providing you information about your diagnosis, about your treatment, about the symptoms you might experience, helping you to manage those symptoms. It can be a variety of disciplines. More often than not, you come into contact with your clinic nurses and then your chemo nurses, the radiation therapists who are providing radiation therapy, dietitians if you're having issues with your with nutrition, physiotherapists, occupational therapists. Many experience lymphedema as one of the more common side effects of cancer, and it's physios that can help with that. So the psychosocial health services umbrella incorporates a large number of clinicians and specialists, each able to provide care to you depending on the needs that you're identifying. So why is this important? Again, I think anyone who's gone through cancer diagnosis and treatment doesn't really need me to explain why it's important. But in the clinical literature, it tells us that 35 to 45% of cancer patients experience clinically significant distress at some point while dealing with cancer. And also that spouses, partners, people that we depend on, whether they may not be spouses or partners, but they can be just as important in your life. They can be as distressed or more distressed than patients. It's important because heightened distress has often gone unnoticed. It's associated with a number of negative outcomes, and it's treatable. There's evidence-based treatment that we can actually make it better. We can improve patient experience. We can improve quality of life. And I'm going to speak some of the data I'm going to share with you. I'm not going to talk a lot about data, but it's Nova Scotia most of the time because that's where I work. But our data in Nova Scotia is consistent with this, but also across Canada, cancer programs are also seeing the same numbers. So that's a lot of people. And then I'm going to show you actually, I think I'm always want to skip through my slides, and so I'm going to try to stay focused on the slide in front of me, but a slide coming up will show it a little bit better. One of the things that we've tried to adopt across the country is patients come first. Your symptoms and concerns matter as a standard of care. In other provinces, it might be known as distress screening, but it's a way for us to not miss people because in busy clinics, when there's lots of things happening and lots going on, and it sometimes can be easy for issues that are not front and center to not be asked about or to not be noticed. And then sometimes, that can grow into a bigger concern. But even if it doesn't, I feel like the best care possible for our patients is to ensure that we're treating, as I said in the first slide, the whole person. And so by providing patients periodically with a distress screen to complete, it gives you as a patient permission to tell us, this is what matters to me, this is what's important, and this is what I need help with, and helps us, you know best. And more programs are moving towards patient-reported outcomes, is what we call them. But it's rather than the clinician leading the assessment and determining what's most important, it gives patients the ability to tell us what's most important. So this was the slide I was alluding to. So I hope you guys can see that. I think that you probably can, because it's pretty big on my screen. So it basically just helps us to overall talk about what is it that our patients need. And we know 100% everybody who's diagnosed with cancer needs some basic emotional support, good communication, good symptom management. Another level, 30% more, will also require additional information. They might need additional education. They might need support groups. They might need, encouragement to seek additional help. The 35 to 40 that I talked about in the last slide will also require specialized professional intervention. So that could be psychosocial oncology. It could be supportive care, depending on what the symptom is and what the area of distress is. And then the small few at the top will require, or at the bottom, I guess, will need complex care. And partly I show you this slide to show you that it's normal for all cancer patients to need help, to ask for help, to be given the help and support that they need. And the majority of people, that's all they're going to need. And so it helps to normalize, I think, the experience for many cancer patients. Not only in the literature, but in all the work that we've done, it's come across loud and clear that psychosocial oncology is important. And so we've heard it through surveys, through focus groups, interviews. We have patient advisors on almost all of the work that we do. We have a patient and family advisory council, and overwhelmingly, patients identify it as an important part of their cancer care. In a recent survey that we did, I think it was in 2022, the majority of our patients identified psychosocial care as very important or an important part of their cancer care, 62%. And then even when you add the 26% of mildly important, you can see there's not very many that don't consider this an important part of the care that they receive. And then just one more study that we recently did as well, because I think it added, the CIHR study did add a little bit more data to what we already knew, and kind of validated some of the findings that we have on the front line, but that this kind of care should be available to patients regardless of where they are in their cancer experience. So from the time of initial screening, waiting for a diagnosis is probably one of the most difficult times for patients, and one of the times where there are the fewest resources available because they're not yet a part of a cancer program. So recognizing the gap in care that's available and the heightened anxiety and emotional need, I think, at all stages of a patient's experience really makes a difference and really matters, and it goes beyond end of treatment to survivorship, living with cancer, and through end of life care, but also providing support and counseling if needed to family or caregiver support. And many programs don't actually provide that, and mostly it's a resource issue that there are not enough clinicians on staff to be able to provide the kind of care that patients and their families often need. So how can we help? There's many ways that we can help. The psychosocial oncology healthcare professionals provide psychotherapy, counseling, emotional support, practical resource counseling, financial counseling, medication counseling for accessing medications, and probably almost anything you can think of, travel support for individuals who are dealing with cancer. And more so now since COVID, services are offered virtually as well as in person. But the virtual care has really made a difference in, in helping with equity issues and providing support for patients who might live in rural or remote communities. And I think the last individual who was speaking, I just got part of her comments, but when you live far from a cancer center, there's so much involved in getting to your treatments and from the cost to finding travel, transportation, place to stay, food. And then also for many patients, they're dealing with cancer-related fatigue and just don't have the energy to be able to do that much back and forth, especially for appointments that can be done virtually. So now, yes, digital literacy is a barrier. So we recognize that, of course, and many areas don't even have good enough internet to be able to support this. But I think as an alternative, it works for some. And if we're always kind of keeping in mind that it's not going to work for all, that there needs to be many options of how we provide care, I think that's an important takeaway as well from all of this. Types of services, as I already talked about this a little bit, but individual counseling, couples counseling, support groups, psychoeducational groups. And then what are some of the cancer-related issues that we can help address? And again, I talked a little bit, I don't have to go through this whole list, I guess, and I'm sure we've missed things here, but coping with the diagnosis, with treatment, with symptoms. For many patients, they actually have a harder time with the symptoms and side effects of their treatment than they did of the actual cancer that they have. So that can be really challenging. Living with uncertainty, the worries, the fears, the anxiety, sadness and depression, regret, guilt and anger, meaning, purpose, and finding hope. Lots of work being done around body change and sexual health and cancer. How do I live after my treatment ends, and what does it look like for me? And am I someone who's in remission? Am I someone who's living with cancer? And it's very different. Different phases of survivorship and what life after cancer looks like for many people. So teaching people coping strategies, helping with financial, practical concerns, dealing with death and dying, and grief and loss. So you can see there's a lot of things there, and probably more things missing. So maybe some of you can, I'm happy to hear other people's stories too. We'll hopefully have time. So how do you get help? I mean, like I said, in the study that we did in 2022 that I referenced earlier, the purpose of the study was really to understand patients' access and awareness of and access to psychosocial resources. So we wanted to know, do people know that these services are out there, and are they able to access them if they need them? And so what we found is that the majority of people do not know that these resources are out there. They didn't know that help was available to them. And we did the same kind of a survey with the healthcare providers that are part of the cancer program. And we saw similar numbers there too. And I don't know if you can appreciate the challenge in continually making sure that those on the front line are aware of what resources are available so that they can share that with their patients. There's so much that frontline staff are needing to remember and do and process and provide safe and accurate care and treatment, that it really is a challenge to also have all of this information at their fingertips. So it's a challenge. It's one that we recognize and we continue to work on. Updating websites, reaching out, asking if you're a cancer patient and you're struggling with something, ask, because chances are that there is help available to support you. And so, I have that written there, but some programs, if you're aware of them, you can self-refer. So most of the time you don't need a referral from your cancer care team to see a social worker or a psychologist. There's also mental health programs in almost all communities, not as easy to access for sure. And sometimes mental health programs will only accept people who have a mental health diagnosis and don't always consider emotional and the kind of care cancer patients require as a mental health diagnosis, which it's not. So, for me, the issue really is how we define mental health needs. And I don't think that we need to pathologize the experiences of cancer patients and in order to get you the help that you need. I think it should be available. If you say you need it, then it should be available to you to help you get through your cancer experience. And then there's also many community-based agencies that provide support, and most of them are underused, and people, I think, again, are just not aware of it. But Canadian Cancer Society, Wellspring Canada both have amazing online support groups. So if you have access to the internet and virtual care, you can access support groups for almost every topic. Disease-specific organizations, so breast cancer. Oh, Heather. Oh, good. Heather's is here, so she's going to be talking in more detail about Canadian Cancer Society. So that's awesome. BC Cancer, other provincial program websites have a wealth of information on those websites that you can access that can be helpful for you. Again, some offer virtual groups that are therapeutic, some are educational, some are practical. Some of the examples, Back to Work, Travel Treatment Fund, that's the Canadian Cancer Society, and I expect Heather will speak to it, but a fund to help people who need support, who need financial support to travel to their treatment. Again, underused. Peer support programs through CCS, 2S LGBTQIA+ support groups, living with cancer support groups, fatigue and brain fog. So there's a lot out there, but and we do our best to connect our patients with these resources, but we're not always successful. And so I hope that conferences like this as well are a way for us to spread the word. And I couldn't agree more with the patient who was speaking earlier around advocating for what you need and for your own health care and for your own emotional care as well, your mental health and your emotional needs and your practical needs. But I also recognize that some of us are better at that than others, and it's not always an easy thing for somebody to do. And we still do work for the most part within a medical model of care, and it can sometimes feel like the most important thing is, the diagnosis and the treatment that I'm receiving, and that the other stuff doesn't matter as much because you don't want the focus to move away from the medical treatment that could save your life. And I certainly appreciate that. And I guess one of my messages today is it doesn't have to be one or the other. It can be both. It should be both. And if we're doing our job well, then all of your needs are being met, not just your medical needs, not just you going in to get your chemotherapy and then going home to figure everything else out on your own. You don't need to do that. There's a lot of support there. And if we can be connected, if we can connect you to the support you need, then I think we've done our job. So I didn't have the chat on. There were some times where I could see comments being made, but should I stop sharing my screen, Sevtap, so I can?
Yes, absolutely. So thank you, Marianne. This was incredibly useful, not only in terms of having a good summary and recap of what the psychosocial support looks like. And I also appreciate that you integrate the spiritual support into that as well, but also in terms of how the support resources, including through the healthcare systems like your unit or community support groups. So thank you very much. There are a couple of comments
Yeah,
in the chat
I see
box.
that.
Yeah.
Yes. So the one-on-one peer. I'll
Yeah.
just speak to the one-on-one peer support. So I'm going to actually not speak to it because Heather will probably speak to that. I believe there's still a peer-to-peer peer support program through the Canadian Cancer Society. So typically when someone is looking for that kind of support, we refer them to CCS. So yeah. And another question there.
So I think
Do
there
you want me
is
to read it out loud? IWK, so at the IWK, a child is appointed a PCC, not sure what that stands for. Oh, maybe it's underneath here. A point of contact, person point of contact, that helps coordinate the medical team appointments and patient family. It's an excellent way to close the gap and make sure the needs are met. I was blown away how the resources were available and offered compared to the adult world. Yeah, that's so amazing. Like, I'd love for us to be able to have something like that. But I think, and thankfully so, because the number of children with cancer are fewer, they're able to have certain resources that in the adult world it's much more challenging. Like in Nova Scotia alone, which I know we have the highest burden of cancer across Canada, but we're only a population of just over 1 million, and we have on average about 6,500 new cancer diagnoses a year. So if you think about that number, along with all of the carryovers, people who are have been diagnosed, prior to, so all the ones in active treatment, all the ones who are still being followed by the cancer program who need that kind of surveillance, like we're talking a lot of people. So it's challenging.
Yeah. Now, teamwork, dream work, I think this is a term, is amazing. Today we are learning a lot about the support services available to patients and families. We have talked about, patient navigator program, which is crucial in helping patients and families during this very difficult time. And we just learned about, also psychological and social support available to patients and the community support organizations as well. Certainly amazing team, and we need a team to help, I think, patients and families go through this time. So thank you. Wonderful. Unless there is, okay, family care coordinator. The person is clarifying that this is a family care coordinator. I never heard. I hope in Newfoundland and Labrador as well, we will get such a coordinator, certainly needed, and it will help not only patients, but I hope also the healthcare system. So
I'll just add one. I didn't reference cancer patient navigators in my talk because, I don't think they're available across Canada, and I wasn't sure who our audience was going to be, but cancer patient navigators absolutely are very helpful in coordinating care and linking patients with resources. And but again, we have 8 of them across the province, so they're not going to be able to do that for every patient. So my goal is how do we set up a system where every patient is aware of what's available, and if they need it, they know where it is, what it is, and how to access it.
No, absolutely. So I think this is one of the ways that we are increasing awareness about this important support
And
programs.
can I say one more thing?
Yes.
I just want to my pleasure to include radiation therapists, because in my experience, radiation therapists are an incredible support, provide emotional support, provide education, provide so much care for our patients. I love working with radiation therapists, and I think you guys are, I've never heard one patient ever say that they had a bad experience with their radiation therapist. So I think that's a hugely important, you're a hugely important team that provides care to our patients, and much, much broader than just the medical side of it.
Okay. Perfect. Thank you again, Marianne, and thank you everyone who joined us during this session. Now we have a short break and 15 minutes. We are going to come back to this main room, and we have the 2 remaining sessions, one about the advocating for cancer-affected individuals in Atlantic Canada. We will have Canadian Cancer Society's Senior Manager of Advocacy, Heather Mulligan, and local patient advocates. And then we will have Derek Fox, our special guest speaking about Terry's legacy. So stay tuned. In 15 minutes, let's come back. Thank you again, Marianne.
Thank you, everyone. Thank you for giving me the time.
Absolutely. See you folks in 15 minutes.
Bye.